And let me tell you, the one thing I hated as a mom was taking my baby in to get those shots. And even though I knew they were coming and I knew they were good for her, but it's just something about them sticking her and her crying. And I'm just like, oh, I just felt like I wanted to cry. But yeah, but so necessarily, so important. But I get it. But as a parent, you still feel like, oh, you cringe when that.
Absolutely. And so there's a couple things you can actually do to help with that process. So you're going to your doctor's appointment, your kid's getting vaccines this appointment, right? Maybe you're behind, maybe it's just that time. A couple things you can do. One, I am a big fan of holding kids for vaccines, right? Giving a big hug, wrapping them up in your arms. Kids need a lot of positive reassurance, and it's very hard as a parent to co-regulate.
Starting pre-K requires a lot of medical forms, doctor's forms, parent signatures, all of that to get the green light to start. And today we're going to be talking about just that. What do you need in order to get the okay to start school in pre-K from a medical perspective? We're joined today by Allie from the Chicago Department of Public Health, who's going to tell us just that. And so, Allie, why don't we just start with you telling us just a little bit about who you are, your role, and why you're so passionate about child health.
Well, thanks for having me here, Leslie. My name's Alexandra Sontag, she, her pronouns. I'm a nurse practitioner by training, and I work at the Chicago Department of Public Health in our Office of School Health. I'm a little biased because I love kids. Like, I'm a family nurse practitioner, but peds is my jam. I'm a little biased. I love the littles. I love the 3 and 4s, and I love the high schoolers. And the middles are great, but you're talking about
are different.
They're different. Yeah, but this is you're talking about one of my favorite populations today. Yes. 3 and 4-year-olds are super exciting because they are just ready. They're really ready for school. Yeah. Their brains are primed. They are looking for structure. They are looking to be engaged. And so getting kids into the classroom, especially in those structured settings in pre-K 3 and pre-K 4, can be really transformative for a lot of kids and put them on a great path to set them up for success for their whole school career. So excited to be here today. Is that public health is thinking about population health, right? How healthy is everyone? Mm-hmm. As a nurse practitioner, I think about the individual kiddo. Mm-hmm. And so that's kind of this intersection that we're talking about today. Yeah. So there's a lot of standards that are set at the state level that are required to attend daycare, to attend pre-K or kindergarten, that are from a public health lens. And these standards are set so that everyone who comes into the building is healthy and that we prevent the spread of disease between big groups of people. And especially when I think of our pre-K 3 and pre-K 4, they're at higher risk for some complications if they were to get sick. So, for example, measles is coming around the U.S. right now. And it's unfortunate. The great news is that measles is very preventable with 2 doses of the MMR vaccine. And all of our kiddos who are in pre-K 4 will have those 2 doses. Everyone after the age of 1 will have their first dose. And it can be prevented through vaccination. What we do see is that kids under the age of 5 are more likely, if they are unvaccinated and do get measles, to have severe complications and end up hospitalized.
Well, let's back up a little bit because we're jumping into measles.
I know, I'm jumping in fast.
You jump right in. That's okay, but that's all good information. But let's back up to say, what do family need to know about the immunizations that children need to have before they enter school for 3 and 4-year-olds? And why is that important? I know we talked about, just from being healthy, but I also think about it from a teacher lens. Like, those babies at that age, everything goes from, and they touching and they snotting and they blowing in, it's crazy in those rooms. So talk a little bit about what they need first to be healthy, and then,
So what you need is a couple things. You need a physical exam in order to start school. And so this is in line with the standard of care. So we recommend that, once you get through the little babies and you have those appointments every 2 months, every 4 months, every 6 months, then it really goes to a yearly visit. And so every year it's recommended that you take your child to see your primary care doctor or nurse practitioner or PA, and that you just check in on their general wellness. It's a great opportunity for your primary care provider to talk to you about any concerns you have medically, right? Any things that you're seeing that you're like, is this normal? It's a great opportunity because that person is there for you and your child to have those conversations. So just on a broad sense, I love a yearly well child visit. They're like one of my favorite things to do. As a provider, you get to spend time with your families and see how much the kids have grown and have that opportunity to ask questions. Because I'm a new parent myself. My child's about to turn 2. And even as a provider where I know everything, I'm looking things up. I'm asking lots of questions at my annual doctor's appointments because when it's your kid, you worry about everything.
You worry about it. And let me tell you, the one thing I hated as a mom was taking my baby in to get those shots. And even though I knew they were coming and I knew they were good for her, but it's just something about them sticking her and her crying. And I'm just like, I just felt like I wanted to cry. But yeah, but so necessarily, so important. But I get it. But as a parent, you still feel like, you cringe when that.
Absolutely. And so there's a couple things you can actually do to help with that process. So you're going to your doctor's appointment, your kid's getting vaccines this appointment, right? Maybe you're behind, maybe it's just that time. A couple things you can do. One, I am a big fan of holding kids for vaccines, right? Giving a big hug, wrapping them up in your arms. Kids need a lot of positive reassurance, and it's very hard as a parent to co-regulate when a baby is crying, right? All you want to do is fully freak out and lose your mind. But take some deep breaths yourself because kids co-regulate. This means that what you're feeling, they also feel. And so if you can wrap them up in a big hug, practice taking deep breaths with them, right? Depending on how your kiddo is. I'm a big fan of pretending to blow out birthday candles when a kid's giving a shot. I do this myself. I am a nurse practitioner who hates getting vaccinated. I do it. I get my flu shot every year, but oh man, do I get a little queasy. I get very nervous. And so for me personally, I never look at the shot before I get it. They draw it up and I just don't look because it'll make me too nervous. I say, give me to the count of 3 and then give it. And then on the count of 3, so on the 1, I take a deep breath in, 2 deep breath in, 3, I blow out. And if it's a little kid, I say, pretend like you're blowing out birthday candles. Sometimes I'll have those little pinwheels. Make the pinwheel go as fast as you can because there's some really good science behind if your brain is thinking about something else. You're not thinking about the pain. And I will say personally, as someone who's like, I've passed out from blood draws because I am squeamish about my own blood. It really works.
I agree with that.
So there's things you can do to kind of mitigate those nerves. And the truth is you need to work with your primary care provider to understand what vaccines you have, what you're missing, what you need. These are all the standards of care. They're set at the state level for us, for requirements for schools.
And there's no difference between like agency and school because the health requirements are set at the state level. Regardless of whatever setting you're in, your child should be protected.
Yep. So if you're coming to a pre-K 3 at CPS from a daycare setting, it's the exact same standard. So all the paperwork that you've been submitting at your daycare, you would now submit here. If you haven't been in a daycare previously, this might be the first time you're asked for this paperwork. And it's the standard from the state Illinois, Department of Public Health. There's a standard form they fill out. There's a standard vaccine form that they fill out. It's pretty straightforward. If you ask your primary care provider at your regular visit, I also need a school form, they'll just print it out for you. And it's good for 365 days.
That's great. And then the other thing I wanted to know, and I really want to help my circle better understand, is what are some of those other health requirements? So we talked a lot about the physical health, What are the others, like screening or things of that nature?
So we need both a dental exam and a vision exam on record to start pre-K 3. And this is because actually it comes back to school nursing. So I'm a little biased. I love a school nurse, but in the creation of kind of school health, one of the things that early school nurses noticed is that if kids don't have good teeth, they're not eating well, and if they can't see, if they don't have either of those things, they're not going to be ready to learn.
Yeah.
And so it really does come back to that learning and that readiness for school. And so that's why there's a dental and a vision exam requirement, really to make sure that your child is fully healthy and ready to be engaged in the environment, right? If their teeth hurt, if they can't see, they're going to struggle. And so we can subtract that up front by making sure those are being addressed.
So if I'm packing up a book bag of readiness to be ready for school from a health perspective, I have my physical.
Yep.
I have my immunizations.
Yep.
I have my dental.
Yep.
And I have my vision.
Yep.
I have all those.
Yep. You got all your forms in.
I have everything ready.
Yep.
And we don't have to have, what we need to start is the physical, the immunizations, and probably the dental. Vision they can do at the school.
Yep.
You can give consent to that as a parent.
And the dental too.
And a dental you could do, but I take my daughter to the dentist.
Yeah, and so that's the thing is like a lot of families, if your kid has glasses, you're already having a vision exam, right? So leverage the things that you're already doing. If you go to the dentist, have them fill out the form, like you take your daughter. There are options in Chicago Public Schools partnering with the Chicago Department of Public Health. We have dentists come into school.
Yes.
We have vision providers come into schools to provide exams with parental consent on file. But especially with pre-K 3 and pre-K 4, some parents want to be present, and I get that.
Especially for the littles.
Yeah, absolutely. So there are options available if that's something, and those are anything that happens in the schools is at no cost to parents. So some options are always available.
So earlier we talked about forms in the backpack, and I think we got everything we need. So can you spend a little bit of time talking about whole child health and wellness?
Yeah, absolutely. So it's really easy to think about, as a provider, to just think about the problem that's in front of me, right? You're here for vaccines, you're here for a school physical, right? But that's really not everything that goes into being healthy. Yeah. What we're thinking about is also, not only is that child have all the paperwork they need, but also, do they have food at their house, right? Are they hungry? Chicago Department of Public Health, we have WIC. If we have families who are at nutritional risk up to the age of 5 and have financial needs, they qualify for WIC resources. Chicago Public Schools will do enrollment for Medicaid and SNAP benefits. So we're thinking about beyond just their physical health, but also like, are they hungry? Is there food at the table? How is their home environment, right? Like, there's a lot that goes into emotional wellness, right? And some of that factors in here too. So it's thinking about not just the child, but also where that child lives, right? The community, yes. And I also think, when I think of whole child wellness, I also think of parent health. And I think we often put ourselves second once we become a parent, and we're not necessarily thinking about, are we drinking water? Are we going to the doctor? Are we checking in on ourselves? And so I do encourage parents, when they're thinking about getting their kid ready for school, as just kind of a reset, to also think about like their annual appointments.
It's almost like when you're on the plane and when they say, put your mask on first. That's what I was thinking about when you were talking about it. Yes, we want to spend this time. And particularly, as we're coming to the end of the year, this is a good time for parents to start thinking about fall and getting ready and make your appointments, especially for the physical and dental. Like, doctor's appointments are booking like 2 months, 3 months out. It's ridiculous. So
I always tell families, book an appointment now.
Yes. Please.
Just book an appointment now. And then if you get an earlier appointment, great, awesome. But then you have something on the books. Even if let's say your child has some specialty doctors too, this is a good time for you to check in, make sure you have all those appointments. I use summer as like a restart for myself, right? I think of what appointments do I need personally? What appointments does my child need? And just kind of setting us up for the whole year. Sometimes those appointments do take a minute. So don't assume that you're just going to get one, the day before school starts, because it's not. Unfortunately, we have a lot less doctor's appointments available.
And then there is a cutoff date. So schools have a date in October.
Yep. October 15th.
That's right, where they want all students healthy or the forms in place, so we can gauge who needs further support and assistance.
And that's a state requirement, and schools are required to report on a yearly basis to the state as part of maintaining their status.
All right, Allie. So this is one of my favorite parts of the segment. We play a game called Red Light, Green Light. And it's an opportunity for us to bust myths, to share some truths, and really to answer some questions. Because here in the circle, it's all about community. It's all about getting the right information. And so this is a fun way for us to get the information out to our community. And so I'm going to ask some questions. And if it applies and it's correct, then it's a green light. And obviously, if it's incorrect or if it's a myth, or we want to hold up our yellow power. So it's going to be interesting to see if how we gauge the questions and whether we are aligned on our responses. So let's get started. Sure. So what I've been hearing from families, and I'm curious to see how you're going to answer this, is families are asking, if I do not have health insurance, will the school direct me to where I can go to get it?
That's a big green. Honestly, it's one of the coolest things about Chicago Public Schools.
Yes, it is.
It's a really unique model. Even nationwide, most school districts don't do this service, and it is unique to Chicago. It's been called out on the national level by the former HHS secretary as a model, as an innovative practice. And so here in Chicago, any child in Chicago, actually, regardless whether they go to Chicago Public Schools, if you are a school-age child and you need Medicaid, 773-553-KIDS, the Office of Student Health and Wellness, Children and Family Benefits Unit. They have 13 coordinators. They are Spanish-speaking. They have access to a language line. You call that number, you ask to be connected to a coordinator, and that coordinator will sit down with the family and fill out the paperwork for them. They will work with them to make sure they have everything they need. On top of that, though, CPS has a direct submission to the state. So our families don't wait in lines here in Chicago. Right. It's directly submitted. And this is, I think, a real challenge with applying to Medicaid, is sometimes you don't have the right paperwork.
And you don't have the time to do all the back and forth. Like, no one has time for that. I'm
missing a piece. Yeah. You wanted my 2022 W-2 and not my 2021 W-2, right? And what is unique about this model is those Children and Family Benefits Unit coordinators actually get that information from the state, and they just go and tell the family, give me these 3 pieces of paper. And then they resubmit on their behalf.
So please, families, take advantage of that. Like, if you don't have insurance, Allie just said, you don't have to be a Chicago Public Schools student. Call that hotline, get the support you need. In the trying times, especially with measles coming back in the rotation, we want to make sure all of our students are protected. And what better way to be protected is to have the right health insurance.
Yeah, health insurance is unfortunately, the way our health system works is that if you don't have insurance, things are so much harder.
You can't even get an appointment half the time.
Yep. And here's the thing. We're in Illinois. Medicaid covers up to 8 children under the age of 18. Every child can qualify for Medicaid, right? There are some financial requirements, but if you don't have insurance for a child, that child should be insured. Every child should have insurance in the state of Illinois. Now, it's hard to get it in, and that's where the Children and Family Benefits Unit comes in, 773-553-KIDS. You can give them a call. They will call you back. They'll get an in-person appointment. They're spread out throughout the city. Honestly, it's such an amazing resource.
And our office also partners with them, during our application process. We kind of divert parents that way if they say they need that type of support. So I'm so glad you shared that resource. All right, I think we got another question. So here's one that I know from being in CPS. I hear from families all the time that says, I have a doctor's appointment, but it's after the first day of school. So I can't start school until after I go to the doctor's appointment to have the right forms before I can come.
All right. I'm going to go a little yellow here. Hear me out.
Wait. Did I do that wrong? That is not true.
Right. You can start. I was like,
you can't start. What was I thinking? Oh my God.
I was like, so there's some things that you do need, right?
Yeah.
You have to have your proof of residency.
Yeah.
Right. But that October 15 deadline is really the cutoff.
That. Yes, that's
right?
the cutoff.
That's the cutoff. But also, and I also give it a yellow because you probably have seen your doctor in the last year. So sometimes doctors will fill out forms knowing that you have an appointment coming up.
Yeah.
So while it's an extra step, ask, right? You're like, hey, I see that we couldn't get in until September 2nd.
Yeah.
We had our last checkup back in May.
Can I use that?
Can you fill out the form for me?
I picked this up in error. I know that's not true. I know they can start. I don't know what I was thinking.
And there's some things that you do need, right? Not on the medical side, but on the other side.
You need the income. You need the
residency,
Chicago residency. You need that kind of stuff. But all right, so I think our last one is, and I think I won't mess up this time. But is it equally as important to support your child's social emotional health and mental health as it is physical health?
It's easy. It's a solid green.
It's a solid green. It's important. It's necessary. They all have an important role and play an important role. And I think you started talking about it at the beginning. Like all of that is the core of what it will take for your child to be ready and healthy and ready to learn when they're in school.
Well, and I also think that we have this idea that everyone is, that there's like this readiness button that you hit. Yeah. And we're talking about paperwork. When it comes to little kids, that's just not true. Mm-hmm. Every kid is coming in at a different speed with different experiences. And that's really the advantage of having really structured pre-K settings, is that they get to figure that out.
And it's an individualized process, right? So it's not a cookie cutter, like this is what we're doing for all kids. It's really like, let's look at your individual child screenings. Let's look at your individual child progress along a developmental continuum to see where we need to modify and make adjustments for your child. That's one thing I love about pre-K. It's so individualized. Whether you're in a CPS building or whether you're in a community-based organization, you're still going to get that individualized support for your young learner.
Well, and I think that's so true, especially because the difference between 6 months
makes a big
as
difference.
Adults, whatever, right? We're the same age if I'm 6 months apart. It makes a huge difference in those early years. And I think it has to be designed to be individualized, because a September birthday and a May birthday, they're totally different, but they're going to be in the same class. And so wherever your child falls on that spectrum of development, there's something there for them, and everyone kind of gets brought along. And it's really about kindergarten readiness, right? And so pre-K is that great opportunity to build those skills, to get kids ready for kindergarten, where it's much more structured, right? And yes, it'll still be personalized in many ways, but not in the same way that pre-K
and not so structured where it can't be developmentally and can't be fun and it can't be joyful and it can't be, exploratory and curious for kids. So structured in a good way.
Exactly. Structured in a great way. And honestly, children at this age are looking for that structure.
They love it.
They really do. They love a schedule. They love knowing what's coming next. It allows them to help learn to regulate those feelings, right? Helps with transitions, which are really difficult, as my soon-to-be 2-year-old likes to remind me. Transitions are hard. And when you have that structure, when you have that schedule set for your day, it really helps them build those skills.
Yep. Well, Allie, thank you so much for being with us. We have learned a great deal here in this circle just from your knowledge. I also want to thank you for being with the best in CPS and in Chicago. I know Chicago's a city that works.
Absolutely. I'm a native Chicagoan. I'm a K-12 CPS graduate. My whole family works for Chicago Public Schools.
Yay.
My husband's a teacher. My mom's a retired teacher. So, and you know, it's important. And I'm really excited that my child will be joining the CPS family in the next couple of years.
We're excited to have your baby and we will take much care and joy.
Thank you.
Thank you so much for being here with me today.
Good to see you.
All right, Allie. So being a product of CPS, you know about homework, and so after every episode in the circle, we have a take-home pack. And so it's just a way for us to continue to connect with our community. We'll give them a reminder. We'll give them a homework assignment, and we'll give them something to do, right? And so I think for us from this episode, we've shared so much information with families. I think the one thing I want to give them as homework is to create a health folder for your child. I mean, so many occasions I've had to try to find my physical and immunizations, and it was hard. So, what I started doing once I got wiser as a parent, I started making multiple copies because whether it's a sports or whatever, they're going to need a copy. So just create that folder so you can have access to that information. I think, one of the action items is to schedule that appointment. Even if what month are we in? Like April? So schedule now because 1, we know it takes a while. 2, we get it out the way and it's already done. And 3, you're already set to go to meet that October 15th deadline. I think the last thing that I want families to do is kind of share this information with folks who may need it. And also, before, I figure out what the last thing is there anything else you think we should add to the take-home folder?
I mean, honestly, give yourself a little grace. There's a lot of stuff as parents we're asked to do to get ready for school.
Yeah.
And so take care of yourself. I think that's homework, right? Drink your water, make your appointments. Because I truly believe that a healthy child is a product of a healthy family. Yeah. And anything we can do to keep the family healthy is going to mean that pre-K kiddo is set up for even more success.
Great. I think that's it. And I think that's enough information in the take-home pack. I think their homework bag is full. So thank you so much for being here with us today. We appreciate you.
Absolutely. Thanks, Leslie.
Thank you. All right, family. So until next time, brave those waiting rooms, secure your forms, and meet us right here back in the circle.